Hey everyone, and welcome back. Today we're going to be talking about the disorders of the integumentary system, and I'm going to go ahead and warn you that number one, there are a lot of them, and that number two, some of them can be a little graphic. So if you get squeamish, I apologize in advance. Hopefully you're going to be okay during this presentation. Also, if you can hear them mowing right outside of my classroom, I apologize. It's way after 3 o'clock and I shouldn't still be here, but I am. So the first one that we're going to be talking about is acne vulgaris. Acne vulgaris is just a fancy name for typical acne. Causes of acne are things like excessive oil production and clogged pores and hair follicles and things like bacteria, as well as just hormones. Many of you have probably experienced acne before in your life, and it's completely natural and totally normal. Symptoms of acne are just things like whiteheads, which could be closed or clogged pores, blackheads, which are open clogged pores, pimples, red bumps, and then painful pus-filled lumps. Treatment for acne, there are some over-the-counter remedies. There are some antibiotics for people who have really severe acne, as well as laser therapy. Next, we're going to be looking at different types of wounds. So we're going to be looking at 5 different types: lacerations, abrasions, punctures, incisions, and avulsions. So lacerations are caused by sharp objects that typically lead to bleeding, and they cause a cut or a tear of the skin. The image on the top of the screen, top left, would be an image of a laceration on someone's leg. And typically the treatment for a laceration would just be to stop the bleeding and clean up and dress the wound. For an abrasion, this is just when the skin rubs against a rough surface. So it's typically called a scrape because it just scrapes away some of the top layer of skin and doesn't usually cause a lot of bleeding. The treatment for an abrasion would just be to wash the area with soap and water, and if it is bleeding, you can cover it with a Band-Aid. A puncture wound is usually caused by a sharp pointed object like scissors or a knife or a pencil or a nail. And this might be a deep wound that may not actually bleed very much because of the shape of a puncture. The best treatment for a puncture would be to wash the area and stop the bleeding if there is any, but do not remove any object from the wound. If there is an object implanted, then you should seek medical attention right away. An incision is something that is performed during surgery, so it's a surgical cut, and this may require stitches, staples, or glue to be able to hold it together. In some instances, we actually need those things to be able to hold together an open wound as well that wasn't caused by surgery. For treatment, it's always good to just follow your doctor's orders. Specifically, depending on where the incision is, might change how it needs to be treated. Some may want to keep it dry, and some might want it washed and covered. Avulsions is a really traumatic type of open wound. This is where trauma has happened to all layers of the skin because something has been torn off. This is a very, very severe abrasion. Any missing parts of skin or a missing body part would be considered an avulsion. And sometimes you might have to have things like a skin graft or reconstructive surgery in order to treat that type of wound. Let's talk about the healing process of wounds. The first process or first stage would be to stop the bleeding. This is hemostasis. The blood will begin to clot within seconds, typically, depending on how severe the wound is, and this is a good kind of blood clotting. Next, you may see some scabbing over, which is another type of clotting, and this is where the blood vessels are narrowing around the wound and platelets start to form a plug. Fibrin is a particle found in our blood, which is basically blood glue because it holds everything in place, and then a scab forms. Stage 3 would be the rebuilding or the growth or proliferation stage. And this is where the body starts to begin rebuilding that tissue, and collagen helps to repair the skin, and then you have a scar that forms, again, depending on how severe the wound was. And stage 4 would be maturations or strengthening, and this is where the body just continues to repair and strengthen that area, and this is when you might start to feel some itchiness occur around the injured site. Next, we have athlete's foot. An athlete's foot is caused by a fungal infection of the foot, which is actually highly contagious. Symptoms include things like a scaly rash that causes really bad itching, stinging, and burning. And the treatment for athlete foot, because it's a fungal infection, are antifungal creams, keeping the feet really clean and dry and not sharing any towels. I've also heard rumor that athlete's foot can get worse or be caused by wearing really dark colored socks. So sometimes it's recommended that wearing lighter colored socks when you're trying to recover from athlete's foot is a good idea. Next, we have eczema. Some of you may have experience with eczema. This is another really common disorder of the skin, and it leads to just red, itchy skin or patches of skin. Symptoms vary really from person to person, and it can include anything from dry skin to really bad itching, red patches, or even small little raised bumps on the skin. The treatment for eczema really depends on the person and can vary depending on the severity of the eczema. Prevention is really the best key. So avoiding things that you know trigger your eczema, trying to keep your skin as moisturized as possible, and taking shorter showers or baths, because typically the products that we use in our showers and baths, as well as the hot water, can really dry out the skin and cause your eczema to flare up. Next, we have herpes. And herpes actually has two different kinds. You have herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 is the fever blisters or cold sores that you typically see around a person's mouth. And HSV2 or herpes simplex virus 2 is the genital version of herpes. And then you also have herpes zoster shingles, which is a really more severe version of herpes that just leads to really bad itching and scabbing over. Some symptoms really are just painful blisters, and because it is a virus, technically it is communicable, meaning that you can spread it from person to person, and the treatment is really just herpes medication, antiviral medication. Next, we have MRSA, and MRSA stands for methicillin-resistant Staphylococcus aureus. That's a really long name, I know, methicillin-resistant Staphylococcus aureus. Basically, MRSA is a really contagious bacterial infection that can cause infection throughout different parts of the body. And typically, MRSA is found in soil. MRSA can be really difficult to treat with your commonly used antibiotics, things like penicillin and amoxicillin, because it is resistant to those types of antibiotics. 1/3 of most people carry the staph infection in their nose without any problems. However, there are cases where that infection becomes severe. Sorry about that. The downside of staying after school to film videos is that people interrupt you. Okay. So like I was saying, methicillin-resistant Staphylococcus aureus is really resistant to antibiotics, so it can be really difficult to treat. And then most people are able to carry the Staphylococcus aureus pathogen in their system with no problems, but sometimes it can become a problem, and it becomes really hard to treat when it starts to enter the skin, the bloodstream, lungs, or the urinary tract. In some cases, MRSA may look like a bunch of abscesses, boils, or sores on the skin, and it's also tend to be called the superbug. Treatment really just depends on the severity. For some people, they may not have a lot of symptoms, and in some people, it could be life-threatening. There's oral clindamycin, I'm sure I pronounced that wrong, as well as IV vancomycin. Vancomycin, that sounds right. Those are both medications that are commonly used to treat MRSA. Next, we have ringworm. And ringworm is another fungal infection, but it isn't actually a worm. It's really just a red, scaly, ring-shaped patch that will appear on the skin caused by the fungus, and the treatment is just an antifungal cream. Next, we have scabies. Scabies is caused by a tiny mite that gets under the skin and is highly contagious, and it causes a bunch of red, itchy rash all over the skin. Typically, scabies is treated with a topical medication, and topical just means that it's an ointment or a cream or something that you put on the outside of the skin, not something you take orally. Impetigo is a highly contagious pathogen caused by bacteria. Impetigo is a highly contagious infection caused by bacteria that causes a bunch of sores that have a yellow, crusty appearance. And typically, this appears right around the nose, the upper lip, and the mouth area. This is really common in kids because they have the tendency to pick up items off of the ground, off of surfaces that maybe weren't clean, things that they find outside, and they put them near their mouth. And so then they end up with this impetigo infection around their mouth. The treatment for impetigo is just an antibiotic ointment that you apply to the area. It looks way worse than it really is. And in some people, they will continue to get impetigo yearly over and over and over again, well into their 20s, because it is just a bacteria that can live on the skin, and some people are just prone to getting it more often than others. Next, we have psoriasis. So I know it has a P at the beginning, but the P is silent, so it's psoriasis. And in the image, it's actually kind of hard to see what's going on here because psoriasis has the tendency to appear in scaly, silvery-looking patches. It's actually an autoimmune disease that can cause these different patches. Sometimes they're red, sometimes they're more of a scale-like appearance where they're like shiny in the middle and red around the edges. And they appear on the skin and they burn and they sting. Psoriasis is more severe than eczema, and the treatment is really just topical ointments. So again, things you put on the skin, moisturizers, and then sometimes there's therapy or medications that might be involved. When we talk about burns, there are 3 different types of burns. You have first-degree burns, second-degree burns, and third-degree burns. Your first-degree burn is just like a sunburn or if you just barely touch something hot for a split second, and it's usually just red or painful. And the treatment for a first-degree burn would be to cool the burn under running water for 5 minutes, applying some aloe vera gel to help cool it and take away some of the burning sensation on your skin, and then just to cover the area loosely. A second-degree burn involves much more pain, redness, swelling, and blistering. And this involves running cool water 10 to 15 minutes over the area, covering with a sterile, non-adhesive bandage or a clean cloth. And it's important that when you're dealing with a second or third-degree burn that you do not ever apply butter, oils, lotions, or creams, and do not break the blisters, as tempting as it might be. A third-degree burn is the most severe, and this is when you have damaged all 3 layers of the skin versus a second-degree burn where you really only damaged the epidermis and the dermis. Third degree damages all 3 layers, and it can appear white or blackened, and it looks kind of charred, and you may even lose sensation or feel numbness in that area. A third-degree burn should be treated by calling 911. A third-degree burn is very severe, so it needs to be treated with medical treatment. Cover the area with a sterile non-stick bandage. You don't want anything that's going to stick to it or rip the skin off even further. And if the area is really large, you may have to use a clean sheet. And depending on the severity of the third-degree burns, there are some cases where they even have to do skin grafts to try to repair that area. Don't forget about our rule of 9s, which we learned about back when we did responding to medical emergencies. The rule of 9 is basically a way that we just measure the percentage of a body that is burned by dividing the body into different areas, each representing 9% of body surface, and the groin or genital area being a 1%. Again, this rule of 9 does slightly change on children, but this is a really good indication of how to quickly measure how severe a burn might be when someone comes into the hospital. Next, we have skin cancer. So when we're talking about skin cancer, I'm cutting off part of your words. Let me move down here. When we're talking about skin cancer, we are talking about being exposed to UV rays. That's typically the causation of skin cancer. And the most common type of cancer in most people is skin cancer because it's something we are exposed to more than anything else. We are exposed to the sun all the time, and a lot of us probably don't wear sunscreen like we're supposed to. You have a basal cell carcinoma, which is the most common type of skin cancer, and it's the least malignant, meaning the least likely to harm you or cause death. It usually occurs on the face, and the treatment is just surgical removal or radiation. Next, you have a squamous cell carcinoma, and this grows more rapidly and usually metastasizes to the lymph nodes, which can become much more dangerous. The prescription for this would be surgical removal or radiation as well, but it's just more difficult to get to if it does spread to the lymph nodes. And then lastly, we have a malignant melanoma, and this is what occurs in the melanocytes, and it metastasizes very quickly, and it kind of appears as a mole that then changes rapidly. The treatment for this would also be surgical removal, but in some cases you may also need chemo or radiation. So that is everything for our disorders of the skin lesson. I know it was a lot to take in. You're probably going to have to go back and pause and take notes and all that good stuff. But after you finish taking notes on this, make sure that you do go complete the disorders of the skin matching game. It will be a bunch of the disorders like words and then photos that match those words. And it's really good practice to get used to seeing what all of these different things look like and helping you kind of remember all of the different disorders. And then after that, you will have to continue working on your 3D skin model. I'm really excited to see what those will look like, and I know you guys are probably working really hard on them. And then you also will be starting a really easy skin project, disorders of the skin. It's called a project, but it's really not going to be like anything super major, and that is due on Sunday, so you have a few days to work on that as well. Have a good day, guys.